All right, welcome back to the Advanced EMT course. Again, we're using the Pearson's Advanced EMT, a clinical reasoning approach, second edition, the updated version, 2025. Chapter 9, we're moving on. Lifespan development and culture considerations. All right, let's get into this. All right, so what the way a person's beliefs, their values, the behavior, your culture definitely has a lot to do with this. And this varies between the patient's affected interactions with the assessments and differential diagnosis process. So will affect that. And it can differ upon age, your gender, your size. Um, and you must understand what social development is and how it affects your patients. Um, psycho is the psychological maturity that takes place throughout experience. That's what psychosocial development is. That's what it's defined as. Is the psychological maturation that takes place throughout their experiences. So your growth of your emotions, your behavior, uh, stuff like that. Relationships between person and social events at different points in lifespans. So this is how we determine this. The aspects would include how you receive or information is perceived, your mental operations performed to make sense of the information, how we communicate with others, and how we decide what is right and what's wrong. Now, there are several theories on this social development. One of it is the Piaget's theory. He divides it into your childhood development into four different groups. And these are the groups here. And I'm not spending a whole lot of time on these. You can read these in your book. So I do recommend that you go through and read all these. The next one is the Erickson's theory. He says that it's not just your childhood; you will develop psychosocially throughout your entire lifespan. Right? He has different theories: trust versus mistrust, anonymity versus shame, guilt. All these others are on here. Again, this is very well laid out in your book. So please go back and take the time to read through this stuff. We're just not going to spend a whole lot of time on it at this point in time. And there's Kohlberg's theory. He has three different levels. Again, this is in your book, and we're going to move on. Okay. So physical development. So we're currently in the United States, the life expectancy is an average about 76.4 years. Now, this will change and be affected by your gender, your genetics, environment, and behavior, right? We all know that in the past, women have lived longer than men. That is changing a little bit. We know why. Years ago, women were the homemakers. Men were out uh, working. This before OSHA rules and regulations. They were doing dangerous jobs. They were dying young, exposed to different stuff. So there's a lot of reasons because of this. But I do know that it has changed a little bit, and it is getting closer. But women are still living longer than men. Um, and physical and psychological changes will occur throughout your lifespan. Now we're going to talk about lifespan a little bit in different age groups and vital signs for these age groups. We have different age groups. We have several: newborn, infant, toddler, preschool, school age, adolescent, adult, and the adult will be broke down into other categories as well. But these are pretty much kind of normal vital signs. Just remember that these are textbook vital signs, and that just because you don't have the textbook doesn't mean that's not normal. So we need to find out what the normal vital signs for that person is. But it's nice to know that a newborn baby or a neonate is going to breathe 30 to 60 times a minute, heart rate around 100 to 180. That's normal. But what may be normal for a neonate is probably not normal for an adult, right? If we have an adult with a heart rate of 180, that's definitely not normal. But as we can see through these, as we get closer to the adulthood, our vital signs will normalize to what we know as a normal adult vital signs. All right, we're going to start talking about your groups, the neonates and infants, right? A neonate is a child from birth to 1 month, right? Average birth weights is 6.6 to 7.7 pounds. They definitely have immature body systems. Uh, Everything's really immature. Their head is large compared to their body. So, according to disproportionately to their body, their head is a lot larger. Their bones will be soft and less well formed. And they have two of these fontanelles beneath their scalp, right? The soft spots, what we call the soft spot. They got a frontal and an occipital soft spot, and they close at different periods. Infancy. An infant goes from 1 month to 1 year, right? Here's different milestones during the first 3 years is what they got on here. This will be in your book, but some of the big ones are at birth, it's all reflexes mainly. Uh, at 3 months, they're starting to have that social smile. They can raise their head somewhat on up to, all these all the way up to 3 years. Now, neonates and infants. So this is from birth to 1 year. Neonates is from birth to a month. Infant is 1 month to 1 year. They have greater surface area to volume of skin ratio, right? They have larger surface area per volume. Their immune systems are very immature. They're less able to fight infection. They have fewer alveoli in their lungs, and their lungs are fragile. So this means they're very prone to respiratory failure, respiratory arrest, and can occur quickly due to anatomical features of the neonate and infant. They have poor feeding. They can vomit, have diarrhea, and fever, which could lead to dehydration really quick with these age group. When they get a little older, they start getting their immunizations or their shots, and this will start providing some of that immunity. And just remember that crying is the way they communicate. That's all they know. We have a saying in EMS, a crying baby is a good baby for us. So that's the only way they communicate. They're hungry. They're wet. They don't feel good. They're cold. That's the way they communicate. They're scared. Moving on to the toddler age and preschool, right? So toddler is from 1 to 3 years, and preschoolers are from 3 to 6 years of age. They have similar features in these groups. Heads are still kind of proportionally large. They're starting to get more curious about how the world works. They're getting more social. They're very prone to ear infections and respiratory tract infections. Usually the toilet training is complete. And their language and their vocabulary is starting to develop. Now on to the school age. School age from 6 to 12 years old, pre-adolescent. They are starting to get more adult-like. They're not quite there yet, but they're getting more adult-like. They start developing relationships outside of family, that friendship, those friends, that bonding outside mom and dad, brother and sister. They start developing the self-esteem and the identity. Start to be really modest, and they want privacy. One of our biggest growing concerns in this age group now is obesity, right? And as these children are getting heavier, they're getting bullied and discriminated. On to the adolescents. This is between 12 and 18, right? The troubled years. Physical growth nearly complete after puberty, right? They're pretty much almost to the adult stage. Their interest in opposite sex and romantic relationships develop, especially after the completed puberty. They want to be regarded as an adult, even though they can't make adult judgment yet. It's not fully developed, so they have risky behavior. They're self-conscious and concerned with appearance and body image. Into young adulthood, it is from the years of 19 to 40. Peak physical condition. Leading cause of death is trauma, especially in males, right? The risk takers. Here, hold them here and watch this type thing. This is the romantic relationship. This is where we get married, start having our kids, start getting stressed out about work, right? We're out of college and we're going to work, paying bills. We're starting to get those stresses. I don't know if it goes on. No. Just know that between the ages of like 20 and 26, your body is working at peak proficiency, which means all your systems are working the best, and all this other. When they say physical condition, that's what they mean. They don't mean you're Arnold Schwarzenegger all buff. You're just your systems are working at peak performance. Middle age, adulthood. This is from 41 to 60. We start to see the age-related changes becoming apparent. Changing vision, changing hearing. Start seeing the cardiovascular disease. Weight control becomes more difficult. Your metabolism starting to slow down, so weight control is a little more difficult. Menopause in women usually occurs, and a lot of financial pressures. We're also seeing the pressures of our kids growing up. This is about the time they're leaving, but our parents are getting older. They're in the elderly, so now we're taking care of our kids and our parents. Both is a very strengthful, both physically and mentally. Late adulthood is from 61 years onward. Some books will put this at like 65, but this publication says 61. This is where your body starts to slow down, starts to decline, right? Your respiratory, your cardiovascular, renal function, they all start to decline a little bit. Pain perception is decreased. This is how the little lady who falls down and breaks her hip and not complaining of a whole lot of pain, because the pain perception is decreased. You can have the cognitive decline, right? This is where we start seeing a lot of the dementia and the Alzheimer's after this age group. And view of all age varies by culture, right? It depends on your culture how we look at this. Older adults. All right, this is a nice little chart talking about how the systems change, what goes on, like, for example, the cardiovascular system, the heart valves become calcified, um, you get hypertension, your heart rate will go down, you start developing cardiac dysrhythmia, especially they're like afibrillation and stuff like that. Respiratory system, you have diminished cough and gag reflex, weaker cough effort. So if you start choking, it's harder for you to get to clear obstruction. You have an increased risk of respiratory infections, especially pneumonia. So, and on and on and on. This is a nice list. It's in your book. Look it over when you get a chance. Again. So going on with the culture differences. Things that we may take granted in our culture may seem disrespectful, rude, or illegal in other cultures. So we have to worry about bias, stereotypes, lack of understanding. Healthcare providers contribute to disparity, and we have to respect and the elders. Some people have a more holistic view of healthcare. They like, especially I think that like some of the Chinese people, um, or other people, they use more herbal stuff, and that's their culture, their beliefs, and that's okay. Some require same-sex healthcare providers. I know, like the Islam or Islamic people definitely do. Hindu, a lot of those people want the same-sex providers taking care of them. Like women can't expose themselves to any man besides their husband. That's their beliefs. That's their cultures, right? And we have to respect that. And we have to also respect how important prayer is to some of these people. It may not be as important to you, but it is to them. Uh, we have many different health disparities among racial and ethical minorities in the U.S. There's a lot of bias, a lot of stereotypes, lack of understanding that contribute to disparities, right? Health and medical benefits of every culture are rich, complex, and difficult to summarize. Let's break them down a little bit. The Hispanics, right? Hispanics, Latin Americans, there's about 18% of the United States, of the U.S. population is composed of Hispanic or Latin Americans, which is less than 62 million. The African Americans, uh, about 12.1% of the U.S. population. American Indian, Native Alaskan tribes, there's 574 federally recognized tribes between the American Indians and the Native Alaskan tribes. 3.71 million or 1.1% of the U.S. population is made up of Native Americans or the Native Alaskan tribes. Asian, 20.3 million Asian Americans and Pacific Islanders in the United States and Middle Eastern cultures. Islam is the most common religion for people from the Western Asia and Middle East. Talk about grief, dying, and death. People die at any age. People suffer loss and death and loved ones through their lifespan. We're talking about bereavement versus grief, right? And mourning. Those are all good terms for you to look up. 5 stages of death. They're denial, anger, bargaining, depression, acceptance. These are for people who are dying or for family members who people have died, right? I remember that before the age of 6, children don't understand the permanence of death, that death is permanent. Uh, Often, death of a pet is the first interaction that a child gets to actual death or the death process. Some become very anxious and separated from loved ones after. That's how they react to this. May have feelings of abandonment and security of fear. This is with children. Cross culture perceptions on death and dying, right? This may change from one culture to the next. What we see here and how we deal with grief, dying, and death may be totally different than someone in a different culture. For example, Hindus. They strive to achieve freedom from eternal reincarnation. That says if they don't do good in this lifetime, they'll be reincarnated and on and on and on until they reach that karma or that good karma, and then they can extend or move on to a higher level. Judaism branches, there are several: Orthodox, Conservative, and Reform. Once someone dies, there's a period of mourning called Shiva. Buddhism requires for attaining nirvana. It's sort of like Hindu. If you don't reach nirvana, you're reincarnated. Um, Sometimes not even in human form. Islam, the Quran, don't provide strict guidelines on illness and death. In Christianity, we believe in that Jesus Christ is the Son of God and the everlasting death, right? Heaven and hell. So what happens with death in the field? When a patient has died, well-being in the family becomes our priority. Once the patient we know the patient is passed, and there's nothing we're going to do. Our goals will shift towards uh, patient care, our family care, right? Supportive care for the family. We can ask if the family needs to call anybody, if there's anything we can help, anything we can do, um, and always follow your EMS protocols and procedures. Hospice and palliative care. The hospice care is kind of a recent addition to health care. This is where terminally ill patients usually go to a facility or home. And it's like end of life care where we try to keep them as comfortable as possible with like pain meds and anti-nauseous meds like Zofran and stuff like that, and until they pass. Palliative care is to make patients comfortable. Well, like I said, with pain meds, medications for nausea. So let's go into the chapter summary. Again, this is a good chapter to be reading. Understand cognitive, psychosocial, and physical characteristics of a patient from birth to old age. People of different ages have different fears and concerns. Children are smaller, different proportionally bodied, and they also work differently. Elderly are less able to compensate for illness or injury. Health issues and expectations differ by culture and ethnic backgrounds. Cardiovascular disease, cancer, and stroke are the leading causes of death in the United States among the ethnicities. Attitude of seeking to understand others' person's expectations is a universal importance. And that'll do it for chapter 9. So we will see you on chapter 10.